Welcome back to the Medical Entrepreneur IV Chelation Training Series. I'm Adam Sewell, MD, and in this video E1, we're going to walk through a real-world pediatric case study involving severe lead poisoning with encephalopathy, a high-risk scenario that demands urgent, precise medical intervention. As always, this video is for educational purposes only. Actual medical care should follow CDC guidelines, local public health protocols, and appropriate pediatric consultation. Let's begin by understanding what makes this case unique and life-threatening. Patient, 3-year-old male, presenting symptoms, developmental regression, irritability and vomiting, intermittent seizures, decreased responsiveness, environmental history, lives in a home built before 1970, paint peeling in multiple rooms, family recently began home renovation, initial labs, blood lead level, BLL, 82 microgram per deciliter, CBC, microcytic anemia, creatinine, normal, CT scan, mild cerebral edema. This is a classic case of pediatric lead encephalopathy. According to CDC and WHO guidelines, a BLL greater than or equal to 70 micrograms per deciliter with neurological symptoms constitutes a medical emergency. The treatment of choice for this situation is combined IV chelation therapy using EDTA and Dimercaprol, also known as BAL. Let's walk through the protocol. Here's the standard CDC-recommended protocol for pediatric lead encephalopathy. Step 1, initiate Dimercaprol, BAL, dosage, 75 milligrams per square meter intramuscularly every 4 hours. Duration, begin at least 4 hours before starting EDTA. Why? BAL prevents redistribution of lead to the brain when EDTA mobilizes it. Step 2, add IV calcium disodium, EDTA, dosage, 1,500 milligrams per square meter per day as a continuous IV infusion or in divided doses every 8 hours. Duration, typically given for 5 days. Hydration, ensure adequate IV fluids to support renal clearance. Important, never use disodium EDTA in children. It can cause fatal hypocalcemia. Always use calcium disodium EDTA in pediatric patients. During and after chelation, close monitoring is essential, especially because chelation is not without its own risks. Let's go over the critical areas to monitor during this type of treatment. 1. Vital signs and neurological status. Check vitals every 2 to 4 hours during the first 24 to 48 hours. Monitor for signs of increased intracranial pressure, vomiting, altered mental status, bradycardia, hypertension. 2. Electrolytes and renal function. Daily labs, B1, creatinine, calcium, magnesium. Maintain strict fluid balance. Be alert for oliguria or rising creatinine. 3. Repeat BLL testing. Avoid testing BLL within 48 hours of starting chelation. Levels may rise transiently due to mobilization from tissues. Repeat BLL at least 48 to 72 hours after last dose. Once the acute treatment phase is complete, your job isn't done. This child is still at risk for long-term neurodevelopmental complications, even if their BLL normalizes. Lead exposure, especially in early childhood, can cause cognitive delays, behavioral problems, speech and language impairments, decreased IQ, and executive functioning. A structured follow-up plan should include referral to developmental pediatrics, neuropsychological testing after recovery, speech, occupational, and behavioral therapy as needed, ongoing BLL monitoring every 1 to 2 months to ensure no re-exposure. Also, partner with local public health to eliminate environmental lead sources. In many states, this is a reportable condition. Let's summarize. 1. Emergency threshold for chelation is a BLL greater than or equal to 70 micrograms per deciliter with neurological symptoms. 2. Treatment requires both BAL and IV calcium disodium EDTA. Never use disodium EDTA in children. 3. Monitor closely during chelation for renal function, fluid balance, and neurostatus. 4. Arrange long-term developmental follow-up because chelation removes the lead, but it doesn't reverse all the damage. In our next video, Video E2, we'll explore a case of chronic mercury exposure in adults and how to approach chelation from a more functional medicine perspective. Thank you for watching Video E1 of the Medical Entrepreneur IV Chelation Training Series. I'm Adam Sewell, MD, and I'll see you in the next video.